continue with the region called abdomen, and where we are going to review the abdominal cavity, anterolateral abdominal wall, peritoneum and peritoneal cavity, abdominal viscera, thoracic diaphragm, and posterior abdominal wall. We're going to touch into all the basics. We are going to name, right, as much as possible, and in order to cover what is required, right? To learn the basics is a very important and fundamental to learn the abdomen, and where the veins, the arteries, the cavity, the abdominal cavity, has the organs which will be mentioned, right? Usually described, right? And we can't do anything else but since we learn from the writer how to pronounce and how to say the description, and we recite really the concepts, right? We do work as much as possible to not use the same words, right? But still, we find out that there is really nothing else but just that the description has the same words, right? And it might sound like the original writer. We will emphasize and to take a look in your atlas, right? All the parts we already mentioned, right? Following back from the organs that we all priorly have studied, and continuing with the ends of veins, arteries, nerves, lymphatics, right? As well ends or beads of muscles, peritoneums, right? Orifices, muscles, which are where all these veins, which is the irrigation and the innervation, come from to get inside the organs, right? It's not really hard, right? We're gonna make it simple. Usually, when the veins and the arteries show where the organ is, right? We know where it comes from, and eventually it takes the name of the organ which is irrigating or innervating, right? And the end are loops, right? Whether if it's a very short route, whether if it's a medium route, whether if it's a big loop, such as nerves or veins, right? We know, which we know, the human body is like that. Then we're gonna say that the abdomen is part of the trunk between the thorax and pelvis. Has musculotendinous walls, right? And we see that their walls has the abdominal cavity, which contains the peritoneal cavity, abdominal viscera, right? Soft parts, internal organs, such as the stomach, intestine, liver, part of the abdominal pelvic cavity between the thoracic diaphragm, superiorly pelvic aperture, forms the roof of the abdominal cavity, and it has no floor of its own, because what it has is a continuation with the pelvic cavity. The abdominal cavity superiorly extends into osteocartilaginous thoracic cage, the fourth intercostal space, right? The abdominal organs are the spleen, the liver, part of kidneys, stomach, which are protected still by the thoracic cage. Expanding part of the pelvis superior to the pelvic inlet is the greater pelvis, supporting, protecting lower abdominal viscera, part of ileum, cecum, sigmoid colon. This abdominal cavity contains peritoneum, which is a serous membrane lining the abdominal pelvic cavity, and it covers most organs, which also has fat, which is in most of the digestive organs, the stomach, the intestine, the liver, the gallbladder, and pancreas. And a little bit of the urogenital system, kidneys and uterus, ureters, to be clear, and the spleen. We're gonna say the abdominal cavity is the major part of abdominal pelvic cavity, and then we gonna make clear that it's in between the diaphragm and the pelvic inlet, and separates from the thoracic cavity by the diaphragm, thoracic diaphragm, and inferiorly continues with the pelvic cavity. And we're going to say that superiorly has a cover of the thoracic cage, right? And is partially protected and supported by the greater pelvis. And also a little bit of the space, or actually the space which surrounds the multi-layered abdominal walls, and where is located most of the digestive organs, spleen, kidneys, and most of the ureters. And then we're going to take a look in the atlas. Whatever section and way you see that is presented, take a look at it. You will see the abdominal cavity, abdominal pelvic cavity, the pelvic cavity, the pubic symphysis, the pelvic diaphragm, the thoracic diaphragm, the plane of superior thoracic aperture, which is also called thoracic inlet, the thoracic cage, the thoracic cavity, right? And the plane of superior pelvic aperture, and this one is called the pelvic inlet. We're going to be able to see, right, the abdominal regions, right? We're going to have the right hypochondriac, right, which is with the letters, capital letters R and H. We're going to see the right lumbar, right, region, which is represented by the capital R, capital L. And we're going to see the right inguinal region, which is going to be capital R, capital I. The left hypochondriac, right, is going to be with the letter L, capital, and capital H. The left lumbar with double capital L's. And the left inguinal, which is a capital L and capital I. And we're going to see the right upper quadrant, which is R, capital U, capital Q, capital, and the left upper quadrant, which is the L, capital U, capital Q, capital, the right lower quadrant, which is the R, capital L, capital Q, capital, and the left lower quadrant, which is capital L, and capital Q, right? We want to see into the epigastric region or epigastrium, right? The umbilical region, the hypogastric region or hypogastrium, right? We're also going to be able to find the quadrants, right? And we have the median plane, right? Transumbilical plane, the anterior and superior iliac spine, the inguinal ligament, right? In order to place the abdominal quadrants. And we say that on the right upper quadrant, which is the R, capital U, capital Q, we're going to find the liver, the right lobe, the gallbladder, the stomach, the pylorus, the duodenum, part 1 and 3, the pancreas, the head, the right suprarenal gland, the right kidney, the right colic hepatic flexure, the ascending colon, superior part, the transverse colon, the right half. We're going to see on the right lower quadrant the R, capital L, capital Q, capital. Second, the vermiform appendix, most of the ileum, the ascending colon, inferior part, the right ovary, the right uterine tube, the right ureter, abdominal part, the right spermatic cord, abdominal part, the uterus, if enlarged, urinary bladder, if very full. On the left upper quadrant, we're going to be able to see, right, that there is going to be written as L, capital U, capital Q, the organs, liver, left lobe, spleen, stomach, jejunum, and proximal ileum, pancreas, body, and tail, the left kidney, the left suprarenal gland, the left colic splenic flexure, the transverse colon, left half, the descending colon, superior part, the left lower quadrant, the left capital, these regions, right? And be sure that you know all these parts. We're going to say that at the anterolateral abdominal wall, right, is continuous, subdivided in anterior wall, right and left lateral wall, which are also called flanks, and posterior wall for descriptive purposes. This wall we are mentioning extends from the thoracic cage to the pelvis, and this major part is musculotendinous, and its boundaries are between the anterior and lateral wall is indefinite. Its combined terms anterolateral abdominal wall used because some structures such as muscles, cutaneous nerves are anterior and lateral wall existent. And when the doctor examines the anterolateral wall, they can be inspected, palpated, percuted, and auscultated. And where surgeons incise this wall during the abdominal surgery. So you're going to find all these things around the anterolateral abdominal wall, right? At the superior part, you can find the cartilage of the 7th through 10th ribs at the hyphoid process of the sternum, which is called the breastbone, and at the inferior part by the inguinal ligament, and of course the pelvic bones. And it consists of skin and subcutaneous tissue, superficial fascia, and is